If deadliest virus means the virus that almost always kills after symptoms begin, rabies is the strongest answer on Earth. That is why doctors pay close attention to every rare survivor, especially children, because each case is almost like a message from the edge of medicine. One striking modern case came from rural Maharashtra in India and involved a boy only 5 years old. In late 2021, a stray dog bit him several times and left deep wounds on his right hand. That kind of bite is high risk, because rabies virus in saliva can move from damaged tissue toward the nervous system. The boy did receive post-exposure treatment, including vaccine and equine rabies immunoglobulin, but the case report says the protection was not ideal. With rabies, small errors matter a lot because timing, wound washing, and proper immunoglobulin infiltration around the bite can decide everything. Partial, delayed, or poorly given prophylaxis can fail, even when treatment began. About a month after the bite, the boy developed severe brain disease with altered consciousness, vomiting, convulsions, frothing, and meningeal signs. He did not show the classic hydrophobia and aerophobia that many people expect from rabies stories. That made diagnosis harder because rabies in children can look like other causes of acute encephalitis syndrome. Doctors first approached it as acute encephalitis syndrome, which was a reasonable step given the symptoms in front of them. His condition became so severe that he needed intensive care and mechanical ventilation. While the team worked out the diagnosis, treatment included antiviral drugs and broad-spectrum antimicrobials. He also received seizure control and anti-edema treatment to reduce swelling in the brain. One unusual part of the case was the use of artesunate, an antimalarial drug explored for possible antiviral effects in rabies-related care. None of that meant doctors had found a reliable cure for clinical rabies. It meant they were using aggressive supportive care and every plausible tool while his body fought a near-certain killer. Surviving the acute phase alone was extraordinary because once rabies symptoms begin, death is usually the expected outcome. But survival did not mean a full return to normal life. The boy left the hospital with severe neurological damage and needed nasogastric feeding. Later follow-up showed small gains, including recognizing his mother and responding to sounds. But those gains came alongside major long-term injuries, including cerebral and cerebellar atrophy, contractures, dystonia, and serious disability. That brutal outcome shows what rabies does even in a survival story. The virus is not only lethal, it is deeply destructive to the brain and nervous system. That is why this case mattered so much to doctors and researchers. The report said only around a few dozen human rabies survivals had been described worldwide, and many survivors were left with major deficits. The exact number shifts as new papers appear, but the scale stays tiny compared with the huge number of rabies deaths. Rabies still kills many tens of thousands of people each year, mostly in Asia and Africa. Dog-mediated transmission remains the main driver of those human deaths. That makes rabies one of the most tragic viral diseases, because it is also one of the most preventable. Prompt wound washing, correct vaccine use, proper immunoglobulin for severe bites, and dog vaccination can stop most human cases before symptoms begin. Once symptoms start, medicine has no consistently effective cure. The most famous earlier survival was the 2004 American teenager treated with the Milwaukee Protocol. That case used medically induced coma and intensive supportive care, while doctors hoped the immune system would catch up. It changed medical thinking because it was the first well-documented rabies survival without prior vaccination. But later cases showed the Milwaukee Protocol was not a reproducible cure, and many patients still died despite similar treatment. That is why public health experts remain cautious when survivor stories go viral. A rare survivor can teach medicine a lot, but a rare survivor can also give families false hope if the story is oversold. There is another famous pediatric virus survival that can confuse people here. A premature newborn infected with Ebola survived after monoclonal antibodies, survivor leukocyte transfusion, and an early course of what later became remdesivir. But that patient was a female neonate, not a boy, so it does not match this rabies story. The rabies case fits the idea of the deadliest virus better because rabies is almost always fatal after symptoms appear. What doctors see in cases like this is not magic. They see timing, supportive care, unusual resilience, and a rare window into how the body sometimes escapes. What researchers see is a chance to study immune response, brain injury, and the narrow limits of treatment. What the public should see first is the value of prevention. Vaccinate dogs, wash bite wounds immediately, get proper post-exposure prophylaxis fast, and do not wait for signs like hydrophobia. By the time fear of water appears, rabies has usually taken a deadly lead. So the boy from Maharashtra did survive one of Earth's deadliest viruses, but his story is not proof that rabies is now curable. His story is a warning about how narrow survival is, how devastating the damage can be, and how much prevention still matters. In rabies, the true miracle is still stopping the disease before the first symptom ever begins. If you want more simple health stories about rabies, Ebola, and the science hidden inside rare survival cases, subscribe and watch our next human biology video. Rabies earns its terrifying reputation because once clinical symptoms begin, survival is so rare that every case report becomes major medical evidence. That is why a 5-year-old boy surviving after severe neurological disease drew attention far beyond one hospital in Maharashtra. The exposure itself was dangerous from the start because the bite wounds were multiple, deep, and located on the right hand. Hands matter because nerve-rich areas can give the virus a route toward the nervous system after infected saliva enters broken tissue. Post-exposure prophylaxis is powerful, but it depends on doing several steps correctly and quickly. Wound cleaning, timely vaccine doses, and proper infiltration of rabies immunoglobulin around the wounds are not optional details. The case report stressed that the prophylaxis here was not ideal in timing and method, and that may have helped explain why infection still advanced. When symptoms appeared about a month later, the picture looked like severe encephalitis rather than a neat textbook poster of rabies. That matters because real rabies does not always arrive with the dramatic hydrophobia and aerophobia people expect from popular stories. In children especially, the disease can resemble other causes of acute brain inflammation, which delays certainty and complicates early decisions. Mechanical ventilation and intensive care kept him alive while doctors tried to control seizures, swelling, and the dangerous collapse of normal brain function. Supportive care often sounds ordinary, but in diseases like rabies, it can be the thin line that keeps a patient alive long enough for anything else to matter. Artesunate drew attention because it is an antimalarial drug that has also been explored for possible antiviral effects in rabies-related situations. Even so, this case did not prove artesunate or any single drug cured symptomatic rabies. It showed that aggressive intensive care, partial immune response, and unusual resilience can sometimes combine in extraordinary ways. The neurological damage afterward was severe, which is sadly common in the tiny number of rabies survivors described in medical literature. Recognizing his mother and responding to sounds were meaningful gains, but cerebral atrophy, cerebellar atrophy, contractures, and dystonia showed how deep the injury was. That mix of survival and devastating disability is a major reason rabies remains such a frightening disease. The most famous older survival, the 2004 American teenager treated with the Milwaukee Protocol, changed how doctors thought about rabies for a time. But later failures showed that induced coma. And similar supportive strategies were not a repeatable cure that hospitals could count on. Another case often mentioned in dramatic virus stories involved a newborn surviving congenital Ebola after antibodies, survivor leukocytes, and early remdesivir-type treatment. That survival was also extraordinary, but it involved a female neonate, not a boy, and it does not fit the rabies case described here. The clearest lesson from Maharashtra is still prevention, because rabies is far easier to stop before symptoms than to survive afterward. Dog vaccination, rapid wound washing, fast medical care, and correct prophylaxis remain the real life-saving tools in this story. Public health workers keep repeating the same message because it saves lives. Wash the wound, seek care immediately, and make sure vaccine and immunoglobulin are given correctly. Rabies still kills many tens of thousands, mostly through dog transmission, which means the most powerful treatment is often prevention long before the hospital fight begins. For that reason, survivor stories are medically precious but emotionally dangerous because they can inspire research while also tempting the public to underestimate rabies. The science lesson is remarkable, but the family lesson is simple. Treat every serious bite fast and do not gamble on becoming one of the vanishingly rare exceptions.